Bismillah Rahman Rahim. Student, we are going to start a next part of our previous lecture. We have discussed antithrombotic effects of endothelium, and we have discussed structure and the other functions of endothelium as well. Now we are going to start prothrombotic effects of endothelium. It means how endothelium can cause thrombosis in case of injury, in case of infection, in case of inflammation. So now we are going to discuss in detail. At the end of the lecture, you will understand, you will be able to understand role of endothelium in clotting. It means prothrombotic effect of endothelium, and the structure and the function of platelets in detail. And you will completely understand the platelets in the how platelets are involved in the clotting of blood. So these are objectives of our today's lecture. Now we are now this to why introduction and structure and function of platelet is necessary for you, because you are going to study coagulation cascade and thrombosis in coming few lectures. So you should know about role of endothelium or endothelial cell and role of platelet before the start of thrombosis. Now activation of endothelium, when activation of endothelium cells, endothelium occur, or activation of a single endothelial cell occur whenever endothelium or endothelial cell undergo any physical injury, or blood vessel undergo any physical injury, or blood cell or a blood vessel get ruptured, then endothelial cells become become active. So these activated endothelial cells participates in the coagulation of blood, or in the clotting of blood to stop bleeding from our body. Infections can also activate the endothelium. Similarly, inflammation, disturbance in blood flow, smoking, various metabolic abnormalities are also involved in the activation of endothelial cells. Many toxins are involved in the activation of endothelial cells, and most common symptom or genetic symptom is present in Asia, which is hypercholesterolemia. It means concentration of cholesterol in blood, increased concentration of cholesterol in blood can also cause activation of endothelial cells, which can ultimately leads to the clot formation in blood. You have already studied the antithrombotic effects. You have studied in thrombotic effect of endothelium, that thrombodulin binds with the thrombin to cause inactive action, like then thrombodylium so then thrombin become inactive. Thrombin is a major protein involved in the coagulation of blood. In case of prothrombotic effects, or in case of activated activated endothelial cells cause decrease in thrombodulin or down regulation of thrombodulin. So decrease in thrombodulin or down regulation of thrombodulin cannot cause inactivation of thrombin. So due to decreased thrombodulin protein, thrombin become more active, and as you know, thrombin works in the clot formation. So thrombin participate in the clot formation more rapidly. And then there are number of receptors present on the surface of platelets. They become the number of receptors become active due to activation of thrombin. There are number of receptors like glycoprotein receptor 1b, 2b, 3a are present on the surface of platelets जो कि एक्टिव हो जाते हैं. Then आ जाता है another important reason is the absence of protein C. We have discussed in antithrombotic effect of endothelium that protein C binds with the protein C receptors on the surface of endothelial cells, and then protein C become active with the help of vitamin K and involved in the cause of antithrombotic effect. But in case of prothrombotic effect, protein C is absent, or protein C is down regulated due to activated endothelial cells. So absence of protein C can cause can cause failure of antithrombotic effect. So due to failure of antithrombotic effect or deficiency of protein C, coagulation of coagulation in blood can occur more rapidly as compared to previous stage. Then another important condition is the inhibition of, yet decrease of inhibitory factors, decrease of some inhibitory factors. What are the inhibitory factors? Inhibitory factors are those factors which are involved in the inhibition of which are involved in the stoppage of some factors. Like tissue factor inhibitors are those inhibitors which are involved in the stoppage, or which are involved in the which act as a hurdle for tissue factor action. So what are the tissue factors? You know, tissue factors are one of the coagulative factor involved in the coagulation cascade, or involved in the formation of clot. So due to down regulation of tissue factor inhibitors, it means those factors which are involved in the decrease of tissue factor, which are involved in the decrease of coagulative factor, which is tissue factor, those inhibitors become down regulate, or those become less concentrated in blood. Due to deficiency of in these inhibitory factor, tissue factor become more active. Tissue factor binds with the 7a, and tissue factor 7a complex are involved in the formation of clot through coagulation cascade. There is another important point is the upregulation of tissue plasminogen activator inhibitors. Those inhibitors become active which are involved in the breakdown, or in which are involved in the cause, or which are involved in the putting of inhibitory effect on tissue plasminogen. You have studied in previous lecture the role of role of tissue plasminogen activator. uh, uh, you can tissue plasminogen plasminogen is an active protein. Tissue plasminogen activates tissue plasminogen activator. Tissue plasminogen activator activates plasminogen protein into plasmin. So plasmin is activated form. This activated plasmin then breaks the fibrinogen, or fibrin chains, which is known as fibrinolysis. So upregulation of tissue, those factors which are involved in the uh, inhibition of tissue plasminogen activator, they become become upregulate. It means tissue plasminogen activator become less in blood, become low, due to presence of inhibitors, due to presence of tissue plasminogen activator inhibitors. So in simple words, जब टिश्यू प्लाज्मिनोजन एक्टिवेटर इनहिबिटर होगा तब टिश्यू प्लाज्मिनोजन एक्टिवेटर की क्वांटिटी कम हो जाएगी. देन क्या होगा कि फिब्रिन फॉर्मेशन और लाइसिस ऑफ फिब्रिनोजन कैन नॉट टेक प्लेस. देन then blood can cause, or fibrin can cause more hard or stable clot in blood vessel. This is known as, this is the phenomena of this is the prothrombotic effect of endothelium. So and the last one is the, this is fibrin activation. So due to down regulation of trisoplasminogen activation, fibrin gets activated, and fibrin became normal. Fibrin does not undergo lysis, so fibrin can cause meshwork, strong meshwork between platelets. Now another topic we are going to start to understand our uh, thrombotic effect completely is platelets. First of all, we are going to discuss some important things about platelets. You should know well about platelets because you have studied in FSC and you have also studied in physiology, normal physiology of platelets. So I am going to tell you some important points of platelets. Regarding platelets, normal concentration of platelets is around 150,000 to 400,000 per microliter in our blood. In an adult body, 152,000 to 400,000 per microliter platelets are present. Normally involved in the primary hemostasis, and we have discussed some proteins like protein C, thrombin, or coagulation factors. These all were globulin proteins. So secondary hemostasis is occurs due to mostly occur due to globulin proteins. So primary hemostasis, platelets are much important for primary hemostasis. Not only in secondary hemostasis, platelets participates efficiently, but globulins but in secondary hemostasis, role of some other proteins become high. Then a deficiency of platelets from its lower value, it means कि अगर 150,000 से प्लेटलेट्स कम हो जाएंगे एक बॉडी के अंदर, पर माइक्रोलीटर से कम हो जाएंगे, तो दिस कंडीशन इज नोन एज थ्रोम्बोसाइटोपिनिया. देयर आर नंबर ऑफ causes of thrombocytopenia. There are number of causes of deficiency of platelets in our blood, and there are, if platelets concentration gets high, more than 400,000 per microliter, it is known as thrombocytosis. So you should know well about thrombocytopenia, you should well about now thrombocytosis. लेकिन क्या होता है कि क्लिनिकली सिम्टम्स अपीयर होने में टाइम लगता है. इन केस ऑफ डेफिशिएंसी ऑफ प्लेटलेट, देयर इज़ नॉट अ हार्ड एंड फास्ट रूल के डेफिशिएंसी ऑफ deficiency of platelets less than 150,000 platelets per microliter is thrombocytopenia, is a dangerous condition. No, there are few chances that due to any drug or due to any physical condition, for a temporary time period, platelets become low in number, but after a few time, or after a few time, or after uh, few observation or follow-ups, if platelet count gets normal, it means there was any temporary condition. But if a platelet count is less than 50,000, I'm talking about if a platelet count is less than just 50,000, and patient is presenting or not presenting with any clinical symptom, that it means it is that means के कंडीशन जो है वो पेशेंट में कोई ऐसी डिजीज़ है, क्योंकि प्लेटलेट काउंट 150 140 130 तक तो जा सकता है, 120 तक भी जा सकता है, बट 50,000 तक चले जाना इज़ अ डेंजरस, इज़ अलार्मिंग कंडीशन. दैन यू कैन you warns a पेशेंट्स एंड ट्रीटमेंट, मोस्टली ट्रीटमेंट जो है उसको चेक किया जाता है, डायग्नोसिस देखा जाता है. देन व्हाट इज थ्रोम्बोसाइटोसिस? मोर देन 400,000 प्लेटलेट्स in per microliter cause is known as thrombocytosis. But normally if a platelets count is 500,000, it doesn't mean the patient should have any serious condition. Sometimes platelet count greater than sometimes mostly patient sometimes platelet count more than 500 400,000 uh, doesn't have any clinical sign and symptoms. It will be then there are chances के बस कोई any physical या temporary condition भी हो सकती है या disease भी हो सकती है. But if the patient have platelet count greater than 750,000, I'm talking about 750 750,000 per microliter, it means there is a problem in blood, there is any disease which is causing increase in platelet formation. Obviously increase in platelet concentration can cause more chances of clotting. You should well aware about concentration or normal ranges of platelet. uh, Platelets are formed from the megakaryocytes. Megakaryocytes are the precursor or progenitor cells of the platelets. In bone marrow, you can observe only megakaryocytes. Megakaryocytes is a large cell. When megakaryocytes enter in blood vessels, so blood vessels, yeah, epithelium of blood cell, a blood vessel is narrow. So when megakaryocyte try to enter into the blood through endothelium or selectively permeable endothelium, then megakaryocyte cells uh, uh, become megakaryocytes divides or breaks into pieces. These pieces are platelets. So you should also know that platelets are not completely cells. So if the platelets are part of megakaryocytes, are part of cells, so patient platelets are platelets don't have a nucleus. So platelets are anucleated, or platelets are cells, or platelets are cells like structure. Platelets are not completely cells because they are formed by the breaking of megakaryocytes during the entrance into the blood vessels after formation in bone marrow. So in peripheral blood you found platelets, and in bone marrow examination you can observe megakaryocytes. Usually 1 over 3 part of platelets in peripheral blood exist in spleen, or stuck in spleen, or uh, remain in spleen. In the cases of splenomegaly, when spleen become large due to any condition, then there are chances the deposition, or there are chances of homing of more platelets in spleen. So instead of 1 over 3 parts of platelets in spleen, 2 over 3 parts of platelets get stuck in the spleen. So in case of splenomegaly, when spleen is enlarged, so then platelet in peripheral blood become low in number. So to cure thrombocytopenia due to splenomegaly, you should remove spleen from the blood. ठीक है, spleen from the body, sorry, spleen from the body. After removal of spleen from the body, you can observe platelet count, normal platelet count in peripheral blood. How platelets are formed? Platelets are formed from the megakaryocytes. Thrombopoietin is a growth factor protein which usually formed from the liver or released from the liver and move into the bone marrow, where megakaryocytes where it act on megakaryocytes, or they act on common progenitor cells before megakaryocyte. So they act and stimulate the production of megakaryocytes. So thrombopoietin is a protein responsible for the production of platelets, ठीक है, जो कि लीवर से रिलीज होती है. इंटरल्यूकिन 6 is also involved in the production of platelet, stimulate platelet formation. Interleukin 6 usually released in inflammation or malignancies. So interleukin 6 is also involved in the stimulation of platelet, decrease in platelet. And there is another mechanism is which is known as negative feedback mechanism. When a decrease in platelet count occurs in the peripheral blood, then release of thrombopoietin become increase. So when production of thrombopoietin increase, then platelet production from bone marrow be, from bone marrow become increase. So this is negative feedback mechanism के प्लेटलेट कम हो रहे हैं, और कम होते होते प्लेटलेट्स की वजह से लीवर पर बर्डन की वजह, लीवर को पता चलता है कि थ्रोम्बोपोइटिन रिलीज करवानी है अब, सो ज़्यादा थ्रोम्बोपोइटिन रिलीज होती है. इसे कहते हैं नेगेटिव फीडबैक मैकेनिज्म. नॉर्मल लाइफ स्पैन ऑफ सिंगल प्लेट रिलीज एवरेज 10 to 12 days. They are opposite shape, they have opposite shape or than RBCs, because their RBCs are biconcave, they are a convex shape. Platelets have convex shape. Platelets have some very important receptors on their surface. They are also these receptors are glycoproteins. It means they are glycoprotein receptors. It means they are carbohydrates and protein in nature. So some important receptors are present on the surface of platelet. These receptors are glycoprotein receptors. These we can say GP1B receptors, 2B receptors, and 3. These three are very much important receptors. And the outer membrane of the lip for platelet is composed of with lipid bilayer, and same in the some other cells of the body. And calcium chemically system is present. Calcium transfer system is present is on the surface of platelet membrane, which these calcium is involved in the contraction and release, contraction of platelets and release of granules. So in the cytoplasm of platelets, as you know, platelets are derived from the megakaryocytes, and megakaryocytes was a large cell. So a cell contain cytoplasm, cell contains the cytoplasm. So pieces of megakaryocytes, which are the platelets, can get some organelles or part of organelles from megakaryocytes. So actin and myosin filaments are also present in the platelet, which is involved in the contraction and relaxation of the platelets. Thromboxane is also present in the platelet, which also participate with the actin and myosin. Residual of rough endoplasmic reticulum and Golgi complex is also present in the cytoplasm of the platelet, which participate in the somehow protein formation inside the platelet, or act as a channel for transportation of few material. And other important organelle present in the platelet cytoplasm is mitochondria, involved in the production of energy for the proper functioning and activation and aggregation adhesion of platelets. Another important factor which is present in the cytoplasm of the platelet is the fibrin stabilizing factor, or factor 13. Platelet derived growth factors are also present in the platelets, which are mostly platelet derived growth factors are involved in the are involved in the formation of or repairing of blood vessel. So during after clot formation, PDGF release can participate in the blood vessel repairing or formation as well. Some granules, there are two types of granules present in the platelets, and they are very important granules. In many other cells, granules are also present in neutrophils. Neutrophils are granulated. Many granules are present inside the neutrophils, and same in basophils. Now we are going to discuss granules. There are few granules present in the there are few granules present in there are usually two types of granules present in the cytoplasm of the platelet. Alpha granules, most important granules are alpha granules, which are usually protein in nature. So alpha granules are protein in nature, which includes factor 13. It means alpha granules are associated or includes in few other factors like factor 13, platelet activating factor, binding with von Willebrand factor, fibrinogen, and factor 4. These are associated with the alpha granules. Then another important factor granule is dense granules. Dense granules are known usually non protein in nature, or they are not like alpha granules. Usually include ADP, adenosine diphosphate, which is a precursor for ATP as well. So they are involved in the calcium channel, and the binding. They act as a binding agent for vitamin K. Vitamin K. So function of dense granules or associated things with dense granules are now has been described. Now another very much important MCQ is these usually vitamin K in vitamin K participation is necessary for the proper functioning of platelets or granules. With the deficiency of vitamin K, uh, it is very much important MCQs regarding UHS point of view. Factor 2, 7, 9, 10, and protein C and protein S gets deficient in case of deficiency of vitamin K. So with the vitamin K deficiency, किन किन फैक्टर्स की डेफिशिएंसी हो सकती है या होती है, तो ये आपको नाम आ गए, ये एक इम्पोर्टेंट MCQs है, ठीक है। After injury, platelets become active. So platelets start the phenomena of clot formation or adhesion or aggregation. So after injury, gets platelet adhesion started to the site of injury for the initial platelet plug formation. This is known as primary hemostasis. So platelet bind with the then due to injury, endothelium or basement membrane gets exposed. So von Willebrand factor on the basement membrane gets exposed. So GP1B receptors which are present on the surface of platelets binds with the or exposed von Willebrand factors. So GP1B, when GP1B binds with the von Willebrand factor, it can participate in the primary hemostasis plug formation. So deficiency of, if a there is a condition when genetic deficiency of GP1B has been observed, is the Bernard Soler syndrome, and the deficiency of von Willebrand factor in other conditions has also been observed, which is it is the condition is known as von Willebrand disease. So due to deficiency of any of two, then cause bleeding disorder, because due to deficiency of GP1B or von Willebrand factor, initial platelet plug formation become impossible. Then bleeding can occur for a long time. So deficiencies of you have now in next slide you will be able to see a diagram which is very very uh, important and very good diagram to study to observe. In this diagram, you can observe a binding of GP1B receptor with the von Willebrand factor on subendothelium surface. So, GP1B receptor present on the surface of platelet which bind with the von Willebrand factors and cause primary hemostasis plug formation. रहता है कि एक्टिवेशन ऑफ प्लेटलेट्स कैसे होती है। एक्टिवेशन ऑफ प्लेटलेट्स होती है जब देन आफ्टर बाइंडिंग विद द आफ्टर बाइंडिंग विद द von Willebrand factor platelet shape gets changed because platelet needs more surface area for to perform clotting for perform clotting no efficiently. Change in shape occurs from convex to shape. Platelets become spike shaped. It means they get more surface area, and the receptors, especially glycoprotein 2b and 3b receptors, become more active and become more exposed on the surface of platelet. And GP2B and 3A receptors are involved in the binding of fibrin. You have seen in the diagram in previous slide. GB2B and 3A receptors are involved in the binding with fibrin and with the binding with fibrin and with other platelets. So with other platelets and fibrin, a very strong binding can occur, which is then how it means how fibrin involved in the formation of meshwork. So platelets bind with each other through fibrin by the receptors to GP2B and 3A. Of course, the deficiency of 2B and 3A can also damage platelet plug formation, but the deficiency of 1B and or von Willebrand factors can damage more, can cause more damage because more bleeding can cause more side effects. The increase in surface area can cause favors calcium channels, which due to presence of calcium and more calcium ion, coagulation cascade gets starts on the surface of platelets due to presence of calcium ion. Then secretion of in the activated lymph platelets, secretion of granules also occurs. Secretion of granules act as a signals. Secretion of granules is act as a signal when thrombin binds with the platelet activating receptors. Then granules released. Released granules act as attractive force for attractive force for other circulating platelets. So it acts as a chemical, and other platelets which are free, which were moving free in blood moves toward the signals, and the signals released from the primary clot. So the more release of granules cause more aggregation and the gathering of platelet at the site of injury. There is another important aggregation inducer, which is the thromboxane A2. Thromboxane A2 also released from the platelets, which involves in the which involve in the aggregation, or which induce more aggregation of the platelets. So these were all about platelets and the function of platelets and endothelium in clot formation and in the function of anti anti jo coagulant function. So in our next lecture we will discuss coagulation cascade, which is the very much important question or point, or from UHS point of view. So you should well know about the coagulation cascade which is occurring in our body. So for now we are I'm thank you to all. इसको बुक से पढ़िएगा, और जो चीज़ समझ नहीं आती आप पूछ सकते हैं.